In the list provided. So as she stands in the anatomical position, this is her left and this is her right. Proximal versus distal. Her knee is proximal to her foot, while her foot is proximal to her knee. Medial versus lateral. Her nose is medial to her eyes, while her ears are lateral to her nose. Superior versus inferior. Her shoulders are superior to her hips, while her feet are inferior to her hips. Anterior versus posterior. Her chest is anterior, while her back is posterior. Superficial versus deep. Her skin would be considered superficial and her heart would be considered deep. The frontal coronal plane would be making a cut separating the anterior and the posterior sections. The sagittal plane would be making a cut through the middle, making a left and right plane. The transverse horizontal plane would make a upper and lower half. The right and left, the right upper quadrant is right here. The left upper quadrant is right here. The left lower quadrant is right here, while the right lower quadrant is right here. The right and left hypochondriac, the right and left hypochondriac, the left hypochondriac, the right hypochondriac, the hypogastric, the epigastric, umbilical, and the left lumbar and right lumbar, the left iliac, right iliac. And I believe that is all 28.